Hello everyone, my name is Eric Womack and today I will be discussing with you on how to work with African American clients within the therapeutic setting. Um, so firstly, let's begin by looking at African Americans in regards to the population. Currently, there are approximately 42 million African Americans who live in the United States, making up about 13.1% of the general population. Statistically, many blacks live in poverty and are unemployed. Um, live in more substandard housing and have higher death rates than whites. However, the black middle class is still missing in many studies on mental health. Furthermore, a large contributor to the psychological distress of African Americans is due to consistent exposure to violence and difficulties acquiring affordable housing, if not housing altogether. An example of this would be like homelessness. Um, Additionally, black people are 20% more likely to report severe psychological issues than white people. Um, Furthermore, black people are also experiencing more severe forms of mental health issues due to their needs not being met and structural barriers that prevent them from receiving mental health care. Um, Essentially, what this means is that due to the structural inability or just the lack of resources within most black communities, African Americans experience higher rates of mental health disorders. Additionally, just the severity of the mental health disorders are stronger due to the lack of resources and environmental, um, just environmental stressors. Carrying on to further address the lack of resources within the black community, there are financial assistance companies that can help with things such as short-term loans. However, there isn't a central location for which black people can go to seek mental health care. Due to these factors, only 25% of African Americans seek therapy in comparison to the 40% of Caucasians that seek out mental health. Previous research has shown that blacks are more depressed in young adulthood and well into middle age. Um, and then depression seems to kind of decrease. But just on a broad scale, many African Americans experience a form of depression within their early childhood to adult age. Um, this minority group makes use of psychiatric and other resources for mental problems, but there are some African Americans who are unsure about the advantages of psychiatric medication. This can be due to the black community has lost a lot of trust in governmental institutions, um, especially the healthcare institution. Um, and in terms of like medications or vaccines or other things, this is because of the Tuskegee experiment, which basically a lot of blacks were used as human test subjects for syphilis, and they were unknowingly injected with this virus and or this disease, and it caused a lot of ramifications and issues within the black community, but as well as the rest of the world. So now we have health policies that prioritize beneficence and the rights of the patients. But really, a lot of blacks are really skeptical of psychiatric medication because of the way that institutions and things like that have operated in the past, causing more distrust to, just mental health institutions and things of that nature. Blacks may also use mental health services less than whites, but they may seek assistance from mental health professionals for economic reasons and physical health more than whites. It's also important to know that black women are more likely to use mental health services compared to that of black men. The social networks of black women tend to be helpful when they are coping with stress. So, as we'll discuss later within the presentation, but typically African Americans confide within family and close friends for comfort, and within their religious organizations, to cause or for mental relief. But we'll discuss some of the issues with relying on only social nets later on within the presentation. But now let's take a chance to look at the socioeconomic status, or the link between socioeconomic status and mental health. So another significant point to consider is the psychological consequences of current trends in the growth of the Black underclass. In situations such as these, it's important to understand class and socioeconomic status, um, to understand why African Americans struggle with both seeking and acquiring mental health services. Um, so let's examine two prominent sociologists within the field of mental health. Um, their names are kind of hard to pronounce, but Hongshed and Redek. These are German names, but these two sociologists found that people in the upper classes, so essentially these two sociologists, they made a class model that separated the class system within America into five classes. So the top 1% would be considered to be in the first class, and you have like the high class or the upper class would be this, I guess, the second class. The third and fourth class would be considered to be variations or levels within the middle class. And then the fifth class is just lower class, if not homeless people for the most part. Um, so, what these two sociologists found is that people in upper classes, class 1 and 2, were aware of psychological problems, whereas people in the lower classes, class 5, labeled someone with a mental disorder as crazy. Many people in the lower class were referred to mental hospitals by the police and social welfare agencies. Um, so for people in class 1, 2, and 3, referrals came from family members and friends. Class 4 was referred by the police or by physicians. The social causation explanation suggests that people in lower class or lower classes are exposed to fewer resources, greater stresses, and difficulties in life compared to people in the upper class. Therefore, stress mostly affects the emotional ability of people in the lower class than people in the higher class, or than people in other classes anyway. So as we kind of previously talked before, Black people statistically are, I guess, impoverished or live in substandard housing. A majority of African Americans would be considered to be anywhere from class 3 to 5. There are African Americans within classes 1 and 2, but the key difference here to note is that in the higher classes, classes 1, 2, and 3, you have your, your billionaires, your entrepreneurs, your celebrities, and you have the upper class. These people are typically aware of their psychological issues due to family members and friends pointing it out. And they're typically aware and able to go in and get help, and they're usually referred to by friends. But people in the middle class that are like white collar workers, blue collar workers, these people are often referred by, sometimes by friends and family, but mainly by physicians. And then classes 4 and 5, which are the lower working class, and of course, poor people. They're typically referred to by police and by physicians. So they're not really aware of the mental health issues that they face. Also, there's, when talking before about people in classes 4 and 5, they'll be labeled as crazy. So a lot of people write issues or mental health issues off as bad personality in a way, but we'll touch on more of that later within the presentation. So to tie it back in, as we discussed before, many African Americans rely upon their friends, families, social networks, and places of religion for mental relief. Though at times these people and religious institutions cannot address the complex issues of mental health, such as the effects of trauma and abuse, for instance. Since they can't do this in ways that would benefit the need of the individual, compared to, let's say, like a licensed professional that has been trained to deal with these intricate issues. Because, you can deal with, you can have people that can support you in instances, but like, what if these people are in some ways the perpetrators of your trauma or abuse, or can't really help with the root of the issue? It's important to go and see licensed professionals. But these issues are but a few of the many reasons why Black people cannot identify mental health or seek out mental assistance. Um, so before we begin really getting into the nitty gritty, we're going to discuss kind of the stigma of therapy within the Black community. Before I would like to do that, I'd like to bring up a very important topic called double consciousness. Simply what this refers to, and this kind of sheds some insight or some light upon why African Americans feel, I guess, more stressed or have more severe psychological distress than their Caucasian counterparts or other minorities. Firstly, because of the lack of resources and their socioeconomic status due to structural barriers, but also because of this thing called double consciousness. What this means is, so America is typically, white people in America are the hegemonic culture. What this means is that Caucasian people are the status quo, or in somewhat the standard. Everything is made to look or model them. And when you go and you talk or you see Caucasian people, you see them as Americans in America. You don't really see them for the race or anything like that, but you see them as people and you see them as Americans. Blacks have, experienced a lot of things in the past due to oppression and systematic racism, but they haven't necessarily been accepted in America. In some ways, they're considered to be second-class citizens. And they experience a stream of double consciousnesses because their identities of being Black and being an American are in some ways socially considered to be contradictory. Because earlier in the last 100, 200 years or so, though we've seen a lot of progression, many of Americans or just Blacks are seen as Black first before they are seen as American. You can see instances of double consciousness taking place. Like, for instance, we're Americans, and they used to be water fountains in a way that would be like, people would try to use water fountains and Blacks would try to go and use those water fountains, but those water fountains were for whites only. So they kind of have this reinforcement like, I'm Black. Okay, I'm a human, but I'm Black, so I cannot drink here. They see this in movies without diversity. There wasn't a lot of inclusion for Black people, like in institutions like such as the military. Blacks had to fight to be a part of the military, and then when they did, they had to be they were segregated within the military, and they had dirtier jobs to do. But it's this division in a way that is present within every single institution. This division is also present within the healthcare, the institution of healthcare, or in the institution of the medical institution. And so Black people, they kind of experience this stressor of everywhere that they go within America. They have to think that they're Black first before they think about that they're American, or what people see. They see them as being Black before them seeing them as having an American identity. So it's this double consciousness that adds progressive stress to African Americans compared to, let's say, an Asian American or just a Caucasian, because of this conflicting identity. This theory was kind of coined by Du Bois, but it has a lot of validity. So carrying on with the stigma of therapy within the Black community, there's a belief that therapy is mainly for white people or other people rather than African Americans. So this is kind of just going back into what I was saying, that they believe that, most of the things are remind them that they're not wanted or they aren't made inclusively. Like, for instance, we used to have separate schools, segregated schools, and they were saying, separate is equal, until we had, Brown v. Board versus the education, or the Brown versus the Board of Education, in which we ruled that separate is not equal. This is one of those things. They believe that the mental institution, or in terms of healthcare or therapy, is mainly for white people, but we'll delve more into that in a moment. Additionally, Blacks are more likely to believe that mental illnesses are closely related to people's bad personality. This kind of touches back on when we were talking about people in the lower socioeconomic classes would view people who are struggling mentally as crazy or social delinquents in a way, or just having a bad personality. Um, so it's important to reassure patients who are feeling this way that their feelings are valid, and just because they're experiencing these issues don't doesn't inherently make them a bad person. When dealing with African Americans, be sure to be sensitive to their feelings, of course. And if they do feel like they're a bad person for experiencing these feelings, just be sure to comfort them and to just really validate their feelings, or let them know that their feelings are valid. Um, Another key reason why blacks don't seek out therapy is because most blacks feel that white people cannot understand who they are, or fear that they might have to change the way that they speak or dress in order to receive help. Um, we'll touch more into that in a second. But furthermore, due to the prejudice and racial discrimination that blacks face within their communities, they often think that they have to speak to a white male or white female about their problems. This kind of feeds back into the stigma that they think that therapy is for white people, and if they were to go into therapy, they'd have to speak to a white person about their issues. Going back to double consciousness, there's a certain identity or existence that only black people have because they have these contradictory identities within them that Caucasian people don't have to worry about. So the idea of going into therapy and having to face what may very well be your oppressor, or just a white person who doesn't have this understanding of what it's like to be black psychologically, it causes fear, that they would be denied services if they did not present themselves to be more accepted or appealing to white people. What is it? As a result, most of the interactions that blacks have within the therapeutic setting are often mandated or forced into healthcare, or they are forced into healthcare because of issues within the court system, such as custody problems or threats of lengthier sentences and drug violations that can lead to rehab, all of which diminish positive expectations for mental health assistance within blacks as they are forced into it. Therapy involves being vulnerable and expressing oneself. But when forced to be vulnerable, it causes more distrust. As we know, African Americans they live in substandard housing and are typically amongst the poor. The impoverished are more policed. Like we were talking about earlier, that blacks live in more areas with crime due to the poverty that they live in, because of the structural barriers. And we already know that there is a large incarceration problem where blacks are, and other people, of color, are also incarcerated at way larger rates than other people, which is very discerning because of the population, the small amount of black people that actually are in America. But really, because they don't have the resources, or they're just not willingly admitted into mental health institutions, it just feels like it is a white place, but they are not accepted, and they're usually forced into therapy. So they are really distrusting, and it feels, what is the way? It feels like they are forced to be vulnerable because they're mandated to go because of the law, or because of physicians. So I'll talk to you about how to kind of deal with this resistance, but it's something very important to understand what black people are going through when they're coming into therapy, or their perspectives about it. So we're going to kind of discuss the importance of multiculturalism. All of the more reason to really take the time to understand this minority group. But to really understand their struggles, you must first evaluate your own biases, reflect upon how you contribute to this racial dynamic, and find ways to not perpetuate the negative experiences faced by African Americans, both inside and out of a therapeutic setting. Thus, the importance of receiving multicultural training. So here are some tips that I can share with you that will help to better assist African Americans into transitioning into therapy, or to feeling more comfortable with you within the therapeutic setting. Um, so African Americans are more client focused. Um, they are more client. Stop. They are more client focused. They're more client focused than clinician focused in regards to mental health. Though in terms of physical health and finances, they are more clinician focused. Or maybe, I don't know if I said that backwards, but just to reiterate what I'm saying, the alarm threw me off. African Americans are more client focused when they're coming in issues about mental health. But in terms of physical health and finances, they are more clinician focused. They want clinicians to take charge if they're coming about those issues. So when you talk to an African American about why they're coming in today, if it's about mental health or about their emotions, let them drive their therapy. Anything that's external to them or their physical health, they're coming to you for your professional expertise. Either way, they're coming to you professionally, but it's just with a different mindset. Number two, body language is really important. Not so much in the sense of handshakes and greetings, but in terms of countertransference. You don't want to give off judgmental or reserved or I guess just prejudiced vibes. The conveying, so it's important to have just kind of the conveying of openness, vulnerability, and acceptance within your body language. Really set the tone with your body when you're in there, your demeanor, so African Americans can feel comfortable. This is a really good tip that I'm about to give you guys. But really, a specific tool might be to just simply convey understanding and a willingness to understand by allowing the individual freedom to express themselves. Because, like I said earlier, Blacks don't feel accepted into many institutions, or that they can't express themselves, like if they did have mental health issues, because they had this fear of being called crazy or being exiled by their community, or seen as having a bad personality. So it's very important for them to have this space to be able to talk. You need to make it feel inviting, non-judgmental, and that you're going to let them understand. So give them the freedom to really express how they feel and what they're going through, because that's probably one of the only places that they're able to express that openly and willingly. Or simply, if you have the resources available, ask them if they feel more comfortable speaking with a professional of the same minority background. I know that not every facility has people of color working there, which could also reinforce the stigma of, being afraid of talking to a white or male or female counselor. But that's the importance of having multicultural training, so you can still work with these people. But if you have the resources, that person may not have ever had a person of color to talk to, and that could really be a way of helping them address their issues, seeing that there's someone there that they can really trust. So just bring it up, but don't do so blatantly, or like you're just trying to throw all our minorities to this one person and call it, inclusion. That's why it's good to have your multicultural training. But if the option is there, let that person know. It's very important. And then lastly, I just posted some resources and a hyperlink at the end of my presentation, in which you guys can watch a YouTube video about just some of the things that I talked about before, about some of the statistics that Black people undergo, and just, personal rhetoric from another person of the African American community and what it feels like in terms of expressing their emotions in a therapeutic setting. But thank you for your time and have a wonderful day.